in a way that you can see it. Okay? ممكن نمشي ولا واضح.
بسم الله والحمد لله والصلاة والسلام على رسول الله صلى الله عليه وسلم. أشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبد الله ورسوله. Today we as a refreshing restart for this episodes of the lessons. We choose to have some light about what we know as the Islamic medical ethics, and I just want to show that the author of this set of presentation is a Muslim doctor who lives in Israel, and you can see that whatever land you are in, wherever you live in, this doesn't forbid you from being a good Muslim. I mean, this man, in his place, among the Jews, who are the cursed people among those human beings, is trying to make da'wah, and is trying to show how Islam has led the way in the provision of medical ethics. He started by showing the magnitude of Islam in the world, in the current world, and as you see, also that the Islam is the last religion to be revealed for the humankind, but it is now the second largest religion, and it is expected that within 30 years it will be the first one. And it is definitely the first religion regarding the growing of the people. And for a patient, when a doctor deals with a patient as a Muslim, because a Muslim is a Muslim doctor. He is Muslim first, and he is anything else afterward. So we're not like they say that I'm American Muslim. No, we're a Muslim American, we're Muslim Egyptian, Muslim Malaysian, Muslim doctor, Muslim engineer. So my identity first is Islam, and then next anything else comes. But first, my identity or al-hawiyya here is Islam. So as a Muslim doctor, when I deal with a Muslim patient, I have this triangle: the religion, the values, and the beliefs. And definitely the religion is the same everywhere, whereas the values and the beliefs might change from a place to another. And we have to deal with all these, and this is part of the medical profession. As far as the religion, the Islamic laws and rules are driven from the four main sources, which is Al-Quran, Al-Sunnah, Al-Ijma' wal-Ijtihad. The Quran is the holy book, the Sunnah are the hadith of the Prophet ﷺ with the reward or action or even acceptance by the Prophet ﷺ. The Sunnah that the Prophet ﷺ just happened in his time and he accepted its occurrence. So this is a Sunnah. It's called in fiqh Sunnah taqririyya. So a Sunnah fi'liyya wa qawliyya wa taqririyya, where he is accepted that this is okay. The consensus is the ijma' of the clerks, or the wisdom or the ijtihad, which of course has its own values and limitations, and not everyone can have ijtihad, not us, we can't have ijtihad, but it has to be one of the scholars and the ulama. As far as the Quran, there are the values that are driven from the Quran, like honor the parents, be kind to neighbors, protect the weak, give the poor, There are the regulations that regulate the marriage, the divorce, the inheritance, and the business even. There are the forbids like complying, pork, alcohol, prostitution, and there are the condemns like murder, stealing, lying, and adultery. And if you look for these, you find that all these can affect a patient life and a patient-doctor relationship. These are the internal beliefs that we know about in the Islam, the essence of the Iman or Islam, the Tawheed, oneness of Allah subhanahu wa ta'ala, the life after death, angels of God, Day of Judgment, prophets of God. From Adam to Muhammad, 25 have been mentioned in the Quran, but the number of the prophets is maybe 13,000 as in some narrations. Divine decree, which is the fate set in advance, al-qadar, and the books of God. So these are the principles of Iman. Now we go direct to the issues that can be related to our practice: health, religion, and the ethics. Contraception, fertility, cloning, medications, what's haram and what's halal to be used, resuscitation, brain death, organ donation, euthanasia. Do you know what's euthanasia? Hmm? They call it mercy killing. Mercy killing. Like when you have a patient with a terminal disease, metastatic cancer, and then you inject him a KCL injection rapidly to let him into arrest. Death and life after death. All these items and many more, but these are, upcoming, and they are in the upfront of the medical practice. Does have their impact on our daily practice, and the religion has its own impact on the way we practice them. These are the laws and the system of the Sharia, where you have obligatory, recommended, permitted, discouraged, and forbidden. These are the 5 stages. You have something that is fard, obligatory, or recommended, which is mustahab, or permitted, which is mubah. You can do it. And discouraged, which is disliked, and forbidden, which is prohibited. And for each one of these, you have, if you do it, you have a reward. If you do the recommended, you have a reward. If you do the permitted, no reward, but no punishment. If you do the discouraged, no punishment. And if you did the forbidden, you have a punishment. On the other hand, if you don't do the obligatory, you would get punishment. If you don't do the recommended, you would get no punishment. And if you didn't do the permitted, there is no punishment as well. And if you did the discouraged, if you did not did the discouraged, there is a reward. And if you leave the forbidden, there is no reward unless you leave it by a clear intention after it has been offered to you that you leave it for Allah. Then you can be rewarded for it. And this is the Maslow law, which is forbidden enforcing of not doing, and obligatory enforcing of doing, recommended urging of doing, permitted choice of doing, discouraged urging of not doing. And as you can see, it's very, very similar to the Qawa'id al-Sharia. have an obligatory action, which is the 5 pillars of Islam: pilgrimage, charity, fasting, prayer, and testimony of faith. Recommended, like blood and organ donation, circumcision of male infants, breastfeeding for 2 years, human skin bank. These can be recommended in medical practice. They are not obligatory, but if you did them, you can have some reward. Like if you donate your blood for the needy person, if you completed 2 years of breastfeeding as a mother for your child, this is recommended. And when you do the circumcision, permitted. Autopsy is for medical law. Reconstructive surgery, like in post-mastectomy, is permitted. Do not resuscitate order, DNR, when the treatments become futile. This is permitted. Yes, you can, or the patient or his family can deny resuscitation. They can give an order, DNR, do not resuscitate. Withdrawal or withheld therapy is permitted in brain death. Genetic engineering to alter or cure diseased or genes is permitted. Abortion, if pregnancy carries a risk for the mother health, physically or mentally, this can be marriage. And in such a way, you should respect to keep it as secret if they don't want to disseminate it. Pain, analgesic to prevent suffering include morphine is allowed if recommended, as suffering deletes sins, but you have to tell the patient. We have the hadith of the Prophet ﷺ, when the woman came to him and said, إني أسرع وإني أتكشف فالله لي ألا أسرع, which means I got epilepsy and I got exposed when I have the fits. Pray God to me that I don't get these fits. So the Prophet ﷺ said to her, إن شئت دعوت لك وإن شئت صبرت ولك الجنة. If you wished, I will pray Allah for you so that you will be cured. And if you wished, you would be patient to this disease and you would be rewarded the paradise, the Jannah. So she said, Asbir. She chose to be patient and to remain with the disease. And this is an asset. A patient can choose to remain suffering, to put down his sins. He can accept to do that. So, if the patient is tolerating and is willing, don't push him. On the other hand, if he is in pain and in agony and he wants to get relief, let him get the relief, even if you use something like morphine. Palliative care. When death is inevitable, Islam directs that the patient be allowed to die without heroic measures. No need to do unnecessary ventilation and end-of-life support and resuscitation. These things is of no value. We were going to die, every one of us. People, unfortunately, at the very end of their life, and they are coming to the thereafter, and they are still hanging to the very 5 minutes that are remaining, instead of paving the way to the long life that is coming. Doctors should be there in these situations to direct the patient and the family of the patient. Say La ilaha illallah, make repentance to Allah in a nice and easy way. You're not going to tell him you're dying, but you have to remind him. Muslims disapprove of any medical care that may hasten the death of a patient. Of course, we don't accept that. Muslims prefer to die at home if possible, with the family providing comprehensive physical and spiritual support. You can and you should give this option to a dying patient. Tell the family, take him home, be around him, spend your time with him. Just will give him palliative painkillers so that he will be among you in his last time. You will read Quran, you will remind him with Allah and things like that. Death is not prepared for with prior funeral arrangement and viewed as an interference in the God's will. We cannot prepare in advance for funeral arrangement. When the patient dies, it's just simple. Ghusl, kafan, and bury him. Death definition is when spirit leaves the body. Death is inevitable. Every soul shall have a taste of death. In the end of to us shall you be brought back. كل نفس ذائقة الموت وإنما توفون أجوركم يوم القيامة. The dying person should sit up or lie with their face toward Mecca. Ideally, one should die with the declaration of the faith on the lips. So you have to remind the person every now and then, say La ilaha illallah. And if he spoke with anything else, remind him again, say La ilaha illallah. There's nothing wrong telling a patient that you are dying, say La ilaha illallah. I mean, even if you did so, this is the most precious time in his life. من كان آخر كلامه لا إله إلا الله دخل الجنة. Why to miss this opportunity? When death occurs, eyes should be closed, all connected tubes removed, all lips flexed, and the body straightened. This is the position of a dying person. The Prophet ﷺ, when one of his companions died, he closed his eyes with his fingers and he'd say, إن الروح إذا خرجت تبعها البصر. When the soul comes out, the sight goes after. After death, washing and burying the ghusl and burying as soon as possible. And you should do on the right side facing Mecca. Respect for the body and the prayers over the dead. Recitation of the whole Quran, this is not part of the Sunnah. This is not Sunnah to do that. Mourning should not be excessive. You can cry. It's accept to cry, but mourning is not. And this disturbs the dead. And it shows lack of acceptance of the God's will. Funeral and mourning period. Funeral is simple and every human is equal. It's just you pray and you put him in the grave and that's it. Deceased buried in a white shroud. Men 3 pieces and women 5 pieces. Without a coffin, there is no that boxes. Islam forbids cremation. Women are not allowed to attend the funeral. Non-Muslim men may attend. Mourning period are 3 days. Wife mourn her husband for 4 months and 10 days. She is not to remarry, leave her home, or wear decorative clothing. Pregnant widow may remarry 40 days after childbirth. We believe in life after death. Angels visit the dead in the grave during the first night. Believers are comfortable waiting till Judgment Day. Judgment Day with the resurrection of bodies. The good cross to paradise, the bad fall off into hell. Child is regarded sinless until the age of maturity. The soul, spirit of a child is automatically transferred to paradise. Family duties after death. Payment of funeral expenses, payment of his or her debts, execution of his or her will, distribution of the remaining states. The spiritual history, when you're asking your patient, you would ask about life and death meaning for a patient, to know how far or close from Allah subhanahu wa ta'ala he is. You should observe dressing, praying, and reading. When you look for a female that she is uncovered with her hair and dressed in a dress that show up her parts, you would know that she is not a religious woman. So you would tackle her disease in the way that might let her be closer to Allah subhanahu wa ta'ala. You should observe for a person during his disease time whether he prays or not. People, even righteous people, might get loose during their time of illness and they leave prayer. You should observe praying and tell the patient that he can pray even without wudu, even without facing the qibla, even without getting up from the bed, even when he is lying on his back. Listen to the reactions, answers, and remarks of the patient. And these are our major troubles. The barriers to take the spiritual history and observe for spiritual therapy. The lack of time. We don't have time. I have to finish 40, 50 patients in my clinic time. So I don't have time to remind him with Allah and to tell him that this tribulation or this imtihan or this fitna is a test from Allah subhanahu wa ta'ala. The disease is like this. The illness is a test from Allah subhanahu wa ta'ala. And he'd like to see what you're going to do with this test. You don't have time to do so, unfortunately. Lack of training. You're not trained. And training for this is training in the da'wah. If you make da'wah, you can make da'wah for the patient. Because the patient sitting across the desk from a doctor is the weakest person ever. He is just mocking your words. Whatever you're going to say, he's going to do. He will believe that your words is his cure. You can touch his heart. Discomfort with the subjects. Unfortunately, we Muslims are ashamed from making da'wah and feeling like we're not eased. You might speak to your patient about football game or politics, but when it comes to religion, it's a personal subject. Who says so? I mean, وَلْتَكُنْ مِنْكُمْ أُمَّةٌ يَدْعُونَ إِلَى الْخَيْرِ وَيَأْمُرُونَ بِالْمَعْرُوفِ وَيَنْهَوْنَ عَنِ الْمُنْكَرِ وَأُولَٰئِكَ هُمُ الْمُفْلِحُونَ. Fear of activity outside area of expertise. Sometimes you feel like, I'm a doctor, I'm not a sheikh. I can't make this. No, of course you can. I mean, at least you can tell him, are you praying? Hajj Fulan? Observe your praying. You have to pray all the time. Take care. You have no apologize for leaving the prayers. There's no excuse for this. He would say, I have urinary incontinence. I cannot pray because my clothes are always soiled with urine. Then you can explain to him, there is nothing wrong with this. Change your clothes as easy as you can. If you can change it once a day, do it once a day. You can wear a cotton pad or use a condom catheter or do whatever you can do. And don't ever think about this. It will be, and a lot of people don't know that. to make the spiritual history and therapy. And this is how we think it over. Listen to the patient and the family, demonstrate sensitivity and passion, respect the patient's values and beliefs, remain flexible, avoid speculation, respond to who, what, where, and when, and provide reassurance to the patients. These are some of the have been done for this. I think the subject worth going around for a while. There is, I have one other more fatty presentation, but it is all in Arabic. But it's a very big one, and it's a real one. I might let you through the main parts of it, just to understand. Maybe we can go through it.